TMJ, or some people call it TMD, is actually a whole series of jaw problems. It can be muscle, it can be pain in the cheek, it can be ear pain, eye pain, headaches, or it can actually be something directly in that joint that it's referring to, where the pad or disc that's supposed to sit there and move with the jaw has actually come off, and as you open, it pops back on and makes a clicking noise. Or worse, it stays off and it makes a gravelly noise or feel, so that you actually are rubbing things that are not supposed to rub. You can even have versions of TMJ or TMD where the bones are breaking down and you actually have disease up in the joint. With these different levels of conditions, it is a progressive condition. So if you don't do the treatment that your dentist recommends, it will get worse. We don't know when, because it usually happens in episodes, so it'll be okay for a while and then it'll get worse. So if you don't, you can go from the muscles bothering to having something in the joint. You can go from having a click in the joint to having the gravelly sounds. You can go from that to actually having pain all the time up in the joint. TMJ patients have a large variety of treatment options here at Gentner Family Dentistry. We have first a smile and bite analysis that actually helps diagnose what the problem is. We have tools to see, is it the muscles, is it the joints, is it your joint not going up in the right space? And then once we actually know what your specific problem is, we can get you to the right avenue of solutions. There can be just relaxation, there can be trips to the chiropractor or a massage, or it may take an occlusal splint or bite guard depending on what your issue is, so that we actually give you a good bite while we're looking at fixing other things, so that your jaw actually gets to go back up where it needs to be so that it can heal and relax. When we do TMJ treatment with the laser for patients, we can have patients come back and say, yeah, it started to feel better, in the next day or so. But we even have patients that say, as we're doing it, wow, I can feel it making a difference already. It's loosening up and I can actually move better. It's not hurting as much. Some patients have had TMJ pain for years, whether it's because you didn't know what it was, so you didn't come see a dentist to get it treated, or you didn't have treatment options from the place you were at, or because there's so many different parts of TMJ and problems. You could even have a misdiagnosis. When you actually come in and get the correct diagnosis and the correct treatment, we can get you in the correct avenue, whether it's with us, with a specialist, and take off the layers of pain that you've been having for years and finally get back to living and not having it weight down on you so much that it changes who you are.